Hi, this is Bianca Martinez, and I'm going to be doing my video on my eye diagram, defining the structure and the different functions of the eye and different diseases that affect adults and the elderly population. So I'm going to begin by naming the components of the eye diagram that I have drawn up right here. First, we have the conjunctiva, which there's actually two. One on top of the eye and one on the bottom, which I define as those black areas. The conjunctiva is known as the mucous membranes that covers the front of the eye and helps line the eyelids. The second part is the iris, which is up here. The iris is a flat ring-shaped membrane behind the corner of the eye with an adjustable circular opening in the center of the eye called a pupil, which is actually has its own name and structure and a different function. The pupil is a hole located in the center of the iris of the eye that allows for light to hit the retina. Next, we have the lens, which is this area in here. The lens serves as a transparent structure in the eye along the cornea, helps reflect the light to be focused into the retina. And people think the retina is in front of the eye near the pupil, but it's actually this membrane all around the eye. Next, we have the cornea located right here, which is a clear outer layer that covers the front of the eye. The sclera, shown here, is the white part of the eye that surrounds the cornea. I just drew it in a different color so it would be noticeable as I would be able to define it in the diagram. Next, we have the ciliary body, which is located in this small section of the eye. The ciliary body is a circular structure that allows an extension of the iris, known as the colored part of the eye. Next, we have the anterior chamber, which is behind the cornea. The anterior chamber is the front of the eye between the cornea and the iris. The vitreous body, which is the entire body of the eye right here, is composed of a clear gel that fills the space between the lens and the retina of the eyeball of all humans and other vertebrates. Now moving on to the back, we have the optic disc right here. The optic disc is also known as the nerve head, a circular area in the back of the inside of the eye where the optic nerves connects to the retina. The optic nerve, as we learned in our health assessment class, is part of our cranial tube. So when we're doing our assessments, checking our different sensory, the optic nerves is how we're able to check the functions of the eye. Next, we have the macula, which is this small little section here. The macula is part of the retina at the back of the eye. The retina, which is the small membrane that goes around the eye, is an essential part of the eye that helps enable our vision. And lastly, the last component is located above the retina, known as the choroid, which helps circulate blood flow within the eye, making it a vital structure to help the eyes function. And moving on to common diseases in adults, first we have myopia more commonly known as nearsightedness, which is defined as the inability to accommodate for objects at a distance. Myopia is the most common refractive error, with approximately 25% of individuals having this disorder. And this number, the citation I actually got from our textbook. And the second condition, which is the opposite of myopia, known as hyperopia, is farsightedness, the inability to see near items, which in fact the cornea does not have the power enough to focus. A third condition is known as astigmatism, which is caused by an irregular corneal curvature. And astigmatism is actually common. It doesn't mean you'll have them in both eyes. Myself, I have astigmatism and just only in one of my eyes. And common conditions among the elderly population is a glaucoma, which is a group of eye conditions that damage the optic nerve, which in fact we know that the optic nerve is what we need to have good vision. Next, we have a cataract, which is a cloudy area that forms in the lens of the eye, causing blurred vision. It develops slowly and it will eventually interfere with the vision. Next, with the diabetes being a common condition among the elderly population, those diabetic patients are at risk for developing diabetic retinopathy, which is blurred vision, is caused by complication of diabetes, causes abnormal changes in the retina's blood vessel, and the damaged blood vessels can cause the retina to detach. My nursing interventions would be, and how these eye conditions are treated. First, they need to be diagnosed through an eye exam. Most common treatments patients will end up being prescribed either glasses, contacts, and some will opt for refractive surgery known as laser surgery. As nursing management, it is important that we teach our patients to wear their glasses, their contacts, whichever they're more comfortable in, to help them not strain their eyes, and this will help decrease the risk of their vision getting worse. Also, it's important to teach our patients to take frequent breaks, especially when they're focusing on one area for a long period of time. Blinking will also help them relax and focus their vision a little better. And that is my video on the eye and the structure.